We are now in Moscow. It's June 27th, 1991. The occasion is the European Association of Neurosurgical Societies meeting, a fairly historic event. I'm Edward Laws, interviewing for the American Association of Neurological Surgeons, and it's our pleasure to be interviewing Dr. Siegfried Vogel, who is professor of neurosurgery at the Charité in Berlin. Professor Vogel, it's really a pleasure to be able to do this for the archives, and I'm not sure that many of the U.S. neurosurgeons know much about the history of surgery and neurosurgery as it developed in Germany in general and in Berlin in particular, and I wonder if you could discuss that with us.
I think it is a good connection between the United States and Germany, the city Berlin. In the last century, we have a first connection between a famous surgeon of the United States, Halsted. And Halsted was coming to Germany and looked for the modern surgery in the 19th century and was also in Berlin and meet Ernst von Bergmann. In this time he was the chief of surgery in the University Hospital from Berlin, connected with the Charité. And from him he has, Ernst von Bergmann give him, Halsted, many informations about the very short experience in the neurosurgery. Ernst von Bergmann started with the neurosurgery, with the real scientific neurosurgery in 1882, with the first operation in brain tumors and also for the CSF drainage and also for the epilepsy.
It was my understanding that von Bergmann was really the first to apply antiseptic techniques to surgery, and perhaps that was how he began to be successful.
A special regime for the antiseptic operations for the hands, for example, and the skin from the patient, and the success was naturally better than before, and he can make with this regime a real neurosurgery. And Ernst von Bergmann has written, I think it was the first book for the students and for the surgeons in Germany about the surgical treatment of brain diseases in 1887, and the second was in 1889. And he wrote a special book about the treatment in the higher brain pressure. And with these ideas, it was not alone. In Berlin, in this time, it was really a center for neuroscience.
And they were interested in increased intracranial pressure?
He was interested in these diseases and also interested to develop new ways for the surgical treatment. But the colleagues from him was, for example, in the physiology, Émile Dubois-Raymond. And he made the first experiments with stimulation of nerves near to the muscles and discovered the laws for the different steps of the stimulation in nerves. And of the other side, a physiologist was Helmholtz, and he has given many informations for the clinical practice. For example, also the eye mirror, or the ophthalmoscope.
Yes, he developed the ophthalmoscope.
He developed the ophthalmoscope, and of the other side, Albrecht von Graefe, the first ophthalmologist in Europe, the real ophthalmologist, and he introduced this instrument directly in 1864 in the medicine. And it was the beginning of many different fields. In the same time, Hitzig discovered the optical field in the brain, the cortex. He discovered the cortex for the optical system. It was in this time a large concurrence. What is the real localization of the optical information? And Hitzig has discovered in this time the optical system in the area striata. And of the other side, we have in this time also in the clinical neurology famous physicians, for example, Griesinger, Westphal, Romberg, Oppenheim. It was a group from colleagues for Ernst von Bergmann, it was possible to make a new field, or it was possible to begin a new field in the surgery, so-called surgical neurology.
It's amazing how all these people were concentrated in that area, and of course the time was
an
right.
advantage for this. And I think in this time, Hallstedt has a very important information and come back to the United States and was the chief of the medical institutions in Baltimore from the Johns Hopkins University and was founded in 1889. Immediately in this time, he can introduce these ideas, and one of the first residents from him was Harvey Cushing. And Cushing has the information from Hallstedt. And in the beginning of the 20th century, he come to Europe and looked for these new steps, for example, in Switzerland for the endocrinological surgery, or in Germany for the neurosurgery, especially Ottfried Förster in Breslau, but also in Berlin in the famous Center from Neurophysiology and Neuromorphology. And therefore, I think we have a connection between the United States and the Europe, especially in Berlin, in the 19th century. And the history we can continue to the 1933. And we have in Berlin for the neurosurgery famous colleagues, Fedor Krause in the Augusta Hospital, but we have also in the University Hospital in the Charité August Bier. He introduced the peridural anesthesia. And then we have from 1937 to 1945, Wilhelm Tönnis worked in the Charité as a neurosurgeon. He was the first professor for neurosurgery in Germany in this time. But unfortunately, this time was interrupted from the Second World War, and therefore we have no continuous line for the history in neurosurgery. After the Second World War, we have a general surgery. And the special field of neurosurgery was immediately included in the general surgery. And therefore, we stopped the pioneer function from this center in Berlin. And we have many different courses for this situation. And I think now, when we go as a pupil to the United States, for example, I was in '87 in Baltimore for a visiting professor for a short time. And I was a pupil. 100 years ago, Hallstedt was a pupil from Ernst von Bergmann, and I come back to Baltimore and has learned a new idea for the biochemistry and for the neuroscience, especially for the clinical practice.
Right. So now in Berlin, there must be some significant changes that go along with the unification of Germany and the resurgence, as you said, of the specialty of neurosurgery in your city and in your country.
Yes, after the unification, we have a whole capital, and we have a population of 4.3 million people, and we have today 7 neurosurgical departments in the city. I think it is not enough, because we have immediately in the next 10 years increasing of the population to the 6.5 million people.
Really? Oh.
And in 10 years we calculated increasing of from 2.5 million people in the city. And therefore I think it is possible you have 7 different departments, and we have a natural concurrence, but it is not inhibition of the daily work, and we can make a fruitful contact. And therefore, I think we have a very good future for the neuroscientific-based neurosurgery. And we must learn that it is not only necessary to make the routine neurosurgery. It is necessary that we made a new position for the frontal line. What is the limitation in our field? What is possible? And I think in this both direction we have many new questions. For example, we have a new field, the so-called molecular neurosurgery.
Yes.
With diagnostics, for example, the PET scan, the positron emission tomography, we can discover the receptor-free areas, or we can have information about the exchange of transmitters near to the receptors. And therefore, we can make in the future, in the near future, or today, a substitution of transmitters directly near to the receptors. The first step is a neurotransplantation. I introduced this method in Berlin in 1989, and I have transplanted few patients with success and without success, but I think the most important thing is not the transplantation. The most important thing is that we can make with the micro-neurosurgical technique a substitution of a transmitter with the implantation of fresh cells with the beta-tyrosine hydroxylase, with an enzyme.
Yes.
And therefore we going to a second step of microsurgery. We have no orientation only to the microanatomy for vessels and so on. We have orientation to the nuclei and to the receptors and the biochemical determined regions in the brain. And I think in the future we must respect this new structure. We must learn not only the micro-neuroanatomy, we must learn the micro-neurobiochemistry.
Yes.
And then we can make a connection between these two. We have a technical improvement in the last 10 years. We can make, without disturbances of the function, approach to all regions in the brain.
Right.
In the brainstem, also in the spinal cord. We can go to the basic ganglia. But we have today not enough criterions, or we have not a real indication what is the patient for us and what we can do with medical treatment. But I think in the next step we can make a new field, we can open a new field, the molecular substitution, for example, with the micropumps, with a special drainage from equal to the neuroscientist with the brain dialysis, and we made vice versa a brain substitution with the microcatheters.
Yeah, well, I think that's an exciting evolution in neuroscience, and one that we should be happy to be a part of. Tell me how you organize the training of young neurosurgeons so that they can actually move in this direction.
We have the possibility directly after the medical course, the beginning or started the residence to the neurosurgical training. And we have a special plane or a special schedule for 5 years. And I think it is not necessary to educate each people in the same way.
So you have different tracks.
Different directions with the same goal.
Yes.
And I think we must discover in each step what is the special possibility for this. Right. What is the intention? What is the motivation of the individuals and the talent? And for example, I have one young people that is interested in the neuromorphological system. And the first half year I sent to the neuropathology, and he studied the proliferating markers from the brain tumors, and come back and introduced for the intraoperative techniques the key 67 markers and other markers from the nuclei of brains, vimentin and others. And then we can introduce immediately with a young colleague a new method for the clinicians. And of the other side, I have a young people. He is very interested for the epilepsy and neurophysiology and neurophysiopathology. And therefore, I sent these people for a half year primarily to the neurophysiology to introduce special methods for the transcortical stimulation for evoked potentials, motoric evoked potential from the hippocampal region, for example. And the third young lady was beginning in the neurosurgical education, and she is very interested to the neurobiochemistry. And I sent in a center for neurobiochemistry, and she studied the different receptor determinations and the method of the measurement of the exchange of the transmitter near to the receptors. And therefore, we have the possibility from half to 1 year to make a different base for the next step. In the next step, all people go a half year to the neurological department and then come back to the neurosurgery. And then we have a different step to adults and pediatric neurosurgery. And after them, these people can go a second time to a special field. For example, neuroradiology for 3 months, or to the neuropathology, or to a special center for neurosurgery, for example, stereotactic neurosurgery, and then come back with a special experience from the other center. I think it is not necessary, and it is very dangerous when you educate it only in one center.
Yes.
It is necessary you open your doors and you give these young people for 1 year or a half year in another center, and you exchange the people.
Yes.
And the other people come to me, and we can introduce new techniques,
Yes.
we can discuss new arguments, and we have a critical atmosphere between the two different centers. And I think in this way we have the possibility that we have, after 5 years, a very creative neurosurgeon.
It certainly sounds as if you're recreating
Yes.
what Bergman had done in the 19th century. How about your own special interests in neurosurgery? What areas have you personally been developing?
My special field is pediatric neurosurgery. I have made this in the last 10 years and more, and I collected a special experience for the brainstem tumors. I operated during 1 year more than 80 people, 80 children with brain tumors, and in this way I have collected many different experiences. AVMs in children, aneurysms in children, brain tumors in children. It is not too frequent, and therefore I think it is necessary that we build few centers of pediatric neurosurgery.
Yes.
And it is my left corner in the heart, and I have 12 beds for pediatric neurosurgery, and I think this is a special responsibility in my department.
Dr. Vogel, it's really been a great pleasure to be able to meet with you and to learn from you the history of a great institution, and to some degree the history of the evolution of German neurosurgery. It's fascinating, of course, to have this perspective now in light of the reunification of Germany, and all of us will be interested in seeing what becomes of German neurosurgery under this new reunification. It's been a particular pleasure to be able to complete this interview for the video archives of the American Association of Neurological Surgery. Professor Siegfried Vogel, who is professor and chairman of the Department of Neurosurgery at the Charité in Berlin, has given us insights with regard to the evolution of neurosurgical thinking and neurosurgical technique in Germany as it evolved through the end of World War II. And of course, there have been significant changes and significant advances in the post-World War II period. It's of some interest now that German neurosurgery is very well organized and will be accommodating the political changes that have resulted in the unification of Germany and the assumption under one neurosurgical society of all of the famous chairs that existed in former East Germany. It's also of great interest now that the Soviet Union has had its major political upheaval, and it'll be interesting to see how all of what we used to call the Eastern Bloc of neurosurgery will modernize and work with us to continue to move the whole field forward. Thanks again, Dr. Vogel.